How do you effectively communicate and collaborate with surgeons, anesthesiologists, and other healthcare professionals during a surgical procedure?
In the operating room, effective communication and collaboration with surgeons, anesthesiologists, and other healthcare professionals are essential for ensuring patient safety and optimal outcomes. My approach centers on maintaining clear, respectful, and precise communication at all times, as well as fostering a team-oriented environment. Prior to the procedure, I review the patient's history, understand the surgical plan, and clarify each team member's role and any special requirements for the surgery. I actively participate in the preoperative briefing to ensure alignment on the case details, which includes discussing potential complications, reviewing patient positioning, and confirming necessary equipment. By engaging in this initial discussion, I gain insight into the surgeon's expectations, the anesthesiologist's requirements, and any specific adjustments needed for the patient's condition. During the surgery, I stay fully attentive to verbal and nonverbal cues from the surgical team, promptly responding to any requests or changes in the plan. I prioritize active listening and communicate updates clearly and concisely to ensure everyone is aware of the current situation. For instance, if the surgeon requests an instrument or needs specific assistance, I respond promptly while updating other team members if additional coordination is necessary. When changes in patient vitals occur, I coordinate closely with the anesthesiologist to adjust interventions, ensuring a unified response to maintain patient stability. After the procedure, I participate in the debriefing, sharing observations and discussing any issues that arose. This helps the team continuously improve and ensures that all professionals involved are aligned on post-operative care. I have found that by fostering an environment of mutual respect, maintaining a proactive attitude, and practicing concise and accurate communication, I can collaborate effectively with surgeons, anesthesiologists, and other healthcare professionals, ultimately contributing to the success of the surgical procedure and the patient's well-being.
Outline your approach to managing a code blue situation in the operating room, emphasizing your role and responsibilities.
In managing a code blue situation in the operating room, my approach is centered on maintaining calm, ensuring effective teamwork, and executing well-practiced emergency protocols to provide immediate, life-saving care to the patient. My role and responsibilities in this critical situation involve rapid assessment, efficient delegation, and clear communication to facilitate a swift, coordinated response among all team members. First, I quickly assess the patient's condition to confirm the need for code blue intervention and notify the team to activate the emergency response. My next priority is to initiate CPR or provide advanced airway management if necessary, following advanced cardiac life support (ACLS) protocols. I ensure the crash cart is readily accessible, verifying that the necessary resuscitation equipment and medications are available and in working order. As I work, I communicate clearly with the anesthesiologist and the surgical team, providing real-time updates on the patient's status and any changes in vital signs. While administering care, I coordinate with other nurses to assist in chest compressions, medication administration, or other supportive interventions, depending on each team member's role and scope of practice. I keep the operating room clear of unnecessary personnel to maintain an organized environment, which allows essential team members, including the surgeon and anesthesiologist, to focus on the code blue response without interruption. Throughout the code, I document all interventions, medications given, and any changes in the patient's status to ensure an accurate, comprehensive record of the event. This record is essential for post-event analysis and informing further patient care. Once the patient stabilizes or further action is determined, I assist in organizing a debriefing session to review the situation, address any issues encountered, and refine protocols if needed. By staying calm, utilizing clear communication, and maintaining precise coordination among the team, I help ensure that a code blue response in the operating room is efficient and that all life-saving measures are carried out as effectively as possible.
Discuss a stressful surgical situation you've encountered and how you managed your stress while maintaining focus and efficiency.
One particularly stressful situation I encountered was during an emergency abdominal surgery when the patient began to experience severe hemorrhaging unexpectedly. The procedure suddenly shifted from a routine surgery to a high-stakes scenario requiring quick, decisive action to control the bleeding and stabilize the patient. The pressure was intense, as everyone in the operating room felt the urgency of the situation. In that moment, I focused on staying calm and channeling my attention into supporting the surgical team efficiently. To manage my stress, I relied on deep, steady breathing to help keep my composure and reminded myself that my primary responsibility was to assist in controlling the situation, not letting the stress control me. I knew that maintaining a clear head was essential, both for my performance and to prevent additional stress for the team. I immediately focused on my tasks, such as ensuring the availability of blood products, passing instruments as requested, and continuously communicating updates about the patient's vitals to both the surgeon and the anesthesiologist. Throughout the procedure, I mentally broke down the situation into manageable steps, focusing on one task at a time. This approach helped me maintain efficiency and prevented me from feeling overwhelmed by the gravity of the situation. I relied heavily on my training, trusting in the protocols we had practiced. Knowing that each member of the team was doing their part helped reinforce my own confidence in managing my responsibilities. After the surgery, I took some time to process what had happened, speaking with colleagues about the event and participating in a debriefing to discuss any improvements for future procedures. Reflecting on and sharing the experience with others was an important part of handling the residual stress. Through this approach, I learned the value of composure, teamwork, and relying on systematic protocols in the face of high-stress situations, which strengthened my confidence in handling similar scenarios in the future.
How would you handle a situation where a critical piece of surgical equipment malfunctions during a procedure?
If a critical piece of surgical equipment were to malfunction during a procedure, my primary focus would be to maintain patient safety while facilitating a swift, organized response to the issue. I would immediately alert the surgeon and the rest of the team to the malfunction, ensuring that everyone is aware of the change in circumstances. Communicating the specific problem quickly is essential for the team to assess whether the procedure can continue with an alternative solution or if adjustments to the surgical plan are necessary. Next, I would promptly switch to backup equipment if available, working efficiently to minimize delays. Operating rooms typically have contingency protocols for equipment failure, so I would follow these established protocols to access any pre-prepared backup supplies or devices. If additional equipment or a replacement is needed from another area, I would request it urgently, coordinating with other staff members or support teams to bring it into the room as quickly as possible. Throughout this process, I would maintain constant communication with the surgeon and anesthesiologist, keeping them informed of the equipment status and estimated replacement time. In some cases, the team may need to modify the procedure temporarily while waiting for replacement equipment or reassess the surgical approach depending on the patient's condition. My role here is to stay calm, anticipate needs, and facilitate communication so that the team can focus on the patient without disruption. After the procedure, I would ensure the faulty equipment is reported to the appropriate biomedical or maintenance team to prevent future occurrences. This would involve documenting the malfunction and participating in any debriefings or quality assurance meetings to review how the situation was handled and identify areas for improvement in equipment readiness. This structured response not only manages the immediate crisis but also supports long-term improvements in surgical safety and readiness.
Explain the role of a surgical nurse during a complex procedure, such as a laparoscopic cholecystectomy or a major orthopedic surgery.
During a complex procedure like a laparoscopic cholecystectomy or major orthopedic surgery, the role of a surgical nurse is multifaceted and critical to the procedure success. My responsibilities encompass patient preparation, intraoperative support, and ensuring a sterile, organized environment for optimal surgical performance and patient safety. I work closely with the surgical team, facilitating seamless communication and efficiency throughout the operation. Before the procedure, I review the patient's history, double-check all surgical instruments and supplies, and ensure the equipment necessary for the specific procedure is in proper working order. For a laparoscopic cholecystectomy, this may include checking the laparoscope, insufflation equipment, and specialized instruments. In orthopedic surgery, I ensure availability of equipment like power drills, fixation devices, and any implants needed for the procedure. My preparation also involves positioning the patient and maintaining a sterile field, as well as conducting a pre-surgical timeout to confirm the patient's identity, surgical site, and procedure with the team. During the surgery, my primary responsibility is to provide continuous support to the surgeon, anesthesiologist, and other team members. For instance, I anticipate the surgeon's needs, handing instruments precisely as needed and managing the flow of supplies without delay. In laparoscopic surgery, I may adjust the camera or assist with visualization, closely coordinating with the surgeon to maintain optimal views of the surgical site. In major orthopedic surgeries, my responsibilities may include handling bulky or heavy instruments, managing bone fragments, and passing fixation devices in the correct sequence to support efficient workflow. I also play a vital role in monitoring the patient's condition and communicating any changes in vitals or equipment status to the team. Working closely with the anesthesiologist, I help ensure the patient's stability, adjusting equipment and providing additional resources as needed. If unexpected complications arise, such as bleeding or equipment malfunction, I remain calm and focus on the necessary adjustments, coordinating backup equipment or interventions to support the team without disrupting the procedure. After the surgery, I assist in patient transfer and ensure that instruments are accounted for, following surgical counts to confirm that nothing is retained. I also document the procedure accurately and report on any challenges encountered, contributing to the post-operative debriefing where the team discusses improvements for future cases. Overall, a surgical nurse in complex procedures acts as a skilled, vigilant support for the entire team, blending technical expertise with a proactive, team-centered approach to ensure patient safety, procedural efficiency, and effective outcomes.
Discuss a challenging ethical dilemma you faced in your nursing career and how you resolved it.
One challenging ethical dilemma I encountered involved a patient in critical condition who was refusing a potentially life-saving treatment due to personal beliefs. The patient was fully conscious and competent, and after several discussions with the medical team, they firmly declined the recommended intervention, despite understanding the severe risks involved. As a nurse, I felt deeply torn because, on one hand, my role is to advocate for the patient's autonomy and respect their decisions, but on the other hand, my professional duty is to prioritize patient health and outcomes, especially in life-threatening situations. To navigate this dilemma, I first made sure I fully understood the patient's reasons for refusing treatment by listening empathetically and without judgment. I wanted to create a safe space for them to express their concerns, and this open dialogue helped me understand the cultural and personal values that were influencing their decision. I discussed my concerns with the healthcare team and explored alternative options that might align more closely with the patient's beliefs, presenting these alternatives clearly to the patient to give them as much choice as possible within the framework of medical care. Recognizing the importance of supporting the patient's right to choose, I worked closely with the team to ensure that the patient was fully informed of the consequences of their decision, documenting our discussions to provide a clear record of informed consent. I also connected the patient with a counselor and chaplain, as these resources could provide additional emotional and spiritual support during this difficult time, reinforcing their autonomy while respecting their values. Ultimately, although it was challenging to accept their refusal of treatment, I knew that respecting the patient's autonomy was ethically paramount. My role became one of providing comfort, ensuring pain management, and offering support so that they felt respected and cared for in their final decision. Reflecting on this experience, I realized the importance of balancing advocacy and autonomy, even when it's emotionally difficult. By prioritizing patient-centered care and maintaining clear communication, I was able to navigate the ethical tension and respect the patient's rights while upholding my professional responsibilities.
Can you describe the proper technique for surgical scrubbing and gowning? What are the critical steps to prevent contamination?
The technique for surgical scrubbing and gowning is meticulous and designed to uphold the highest standards of sterility to prevent contamination in the operating room. The process begins with a thorough pre-scrub wash, where I remove any jewelry and use a nail pick to clean under my nails while washing my hands and forearms with antimicrobial soap. This initial step ensures that visible dirt is removed before I proceed to the surgical scrub. For the scrub itself, I use an antiseptic solution, working systematically to clean each surface of my hands and forearms. Starting with my nails, I scrub each finger individually, moving from the fingertips to the hands, then up to the elbows. The goal is to follow a timed or counted stroke method, covering all areas methodically to reduce microbial load. Throughout, I keep my hands elevated and above the elbows to allow water to flow downwards, away from the clean areas, to minimize the risk of contamination. After completing the scrub, I enter the operating room with my hands and forearms held up and away from my body. With the assistance of a circulating nurse, I begin the gowning process. I take care not to touch any part of the gown's exterior while putting my arms into the sleeves, as this outer surface is sterile. Once my arms are in the gown, I hold them outward and slightly away from my body, allowing the circulating nurse to secure the gown at the back. For gloving, I use a closed glove technique, which further reduces the risk of contamination by preventing direct contact between my hands and the outer surface of the gloves. While inserting my hands into the gloves, I ensure that only the inner, sterile side of the glove makes contact with my skin. After gloving, I adjust the cuffs of the gown to secure a tight fit, ensuring that my entire forearm and wrist area remain sterile and covered. Maintaining sterility throughout this entire process is critical. By avoiding unnecessary movements, keeping my hands above waist level, and refraining from touching any non-sterile surfaces, I uphold the aseptic technique necessary for the operating environment. This disciplined approach to scrubbing and gowning helps prevent contamination, contributing to a safe, sterile field for the surgical procedure.
How do you contribute to quality improvement initiatives within the surgical team?
Within the surgical team, I contribute to quality improvement initiatives by actively participating in data collection, implementing best practices, and engaging in continuous education to promote patient safety and procedural efficiency. Quality improvement begins with identifying specific areas where patient outcomes, safety, or workflows can be enhanced, and I play a direct role in gathering this information through careful documentation and observation during procedures. For instance, I closely monitor adherence to surgical checklists, track any deviations, and report these findings to the Quality Improvement Committee, which helps identify patterns and areas needing attention. I also focus on implementing evidence-based practices that enhance surgical safety. This includes rigorously following protocols for preoperative checklists, infection control measures, and post-operative monitoring. If there are new guidelines for sterilization, patient positioning, or instrument handling, I ensure that I am well informed and apply these practices consistently. By adhering to these standards, I help minimize risks, such as infections or procedural delays, that could impact patient outcomes. Continuous education is a key component of quality improvement, so I stay current on the latest advancements in surgical nursing, patient safety, and technology. I attend regular training sessions, participate in workshops, and review current literature on best practices. This proactive approach allows me to introduce new, evidence-based techniques to the team, fostering an environment where quality improvement is integral to our daily practice. For example, when updated guidelines for reducing surgical site infections were introduced, I advocated for new methods in preoperative skin preparation and collaborated with the team to ensure everyone understood and adopted these practices. Moreover, I actively participate in debriefings and morbidity and mortality (MNM) meetings where surgical outcomes are reviewed and challenges are discussed. I contribute by sharing insights and suggestions based on my experiences, as well as listening to feedback from my colleagues. In one instance, a debriefing revealed that communication breakdowns had contributed to procedural delays. In response, I proposed a more structured approach to intraoperative communication, which led to the adoption of standardized handoff and briefing protocols that improved clarity and teamwork within the OR. Overall, my role in quality improvement is rooted in a proactive and collaborative approach that emphasizes continuous learning, application of best practices, and open communication with the surgical team. Through these actions, I contribute to a culture of high standards, helping to enhance both the quality of patient care and the efficiency of surgical procedures.
Explain the importance of surgical counts and the steps involved in performing a sponge, instrument, and sharps count. How do you handle a discrepancy in a count?
Surgical counts are critical to ensuring patient safety and preventing retained surgical items, which can lead to severe complications such as infections, additional surgeries, and even life-threatening conditions. Performing accurate sponge, instrument, and sharps counts is an essential practice in the operating room to ensure that all materials used during surgery are accounted for before closing the surgical site. This meticulous process involves several steps that are followed systematically throughout the procedure. The surgical count process begins with an initial count before the surgery starts, which includes sponges, instruments, and sharps, such as needles and scalpel blades. This baseline count ensures that the surgical team knows exactly how many items are present and available for use during the procedure. Sponges are typically separated by size and type, and each one is tagged with a radiopaque marker to allow for easy detection on an X-ray if needed. Instruments and sharps are counted in a similar manner, with each type grouped together to streamline the counting process and minimize confusion. During the procedure, a second count is conducted before any wound closure begins. This intraoperative count allows the team to verify that all items used so far are present and no items have been retained in the surgical site. Finally, a third and final count is completed once wound closure begins and again before the final layer is closed. These repeated counts ensure a multi-layered verification process, reducing the chance of human error and confirming that no materials have been left behind in the patient. If there is a discrepancy in any count, I immediately inform the surgeon and other team members to halt the procedure and address the issue. First, we recount all items to verify the discrepancy. If an item is still missing, we conduct a thorough search of the sterile field, including under and around surgical drapes, in the waste bins, and within any used equipment trays. Should the item remain unaccounted for after this search, I request an X-ray to locate the missing item, as many surgical items are designed to be radiopaque for this purpose. Throughout this process, I document each count and any discrepancies meticulously, ensuring that a record is maintained for future reference and quality assurance. Handling discrepancies promptly and transparently is crucial to maintaining the integrity of the surgical process and upholding patient safety. By adhering to these protocols, I contribute to a culture of diligence and teamwork that minimizes the risk of retained items and helps safeguard patients during surgery.
Explain the various patient positioning techniques used in surgery and the associated risks and complications. How do you ensure patient safety and comfort during prolonged surgical procedures?
In surgery, patient positioning is essential for providing optimal access to the surgical site, facilitating proper physiological function, and preventing complications. Several standard positions are used depending on the type of procedure and the area being operated on. For example, the supine position, where the patient lies flat on their back, is common in abdominal surgeries, while the prone position, where the patient lies on their stomach, is used in spinal procedures. The lithotomy position, with legs elevated and supported, is used for gynecological and urological surgeries, and the lateral position, where the patient lies on their side, is typical in thoracic and some orthopedic procedures. Each of these positions presents unique risks, such as pressure injuries, nerve damage, and compromised circulation, particularly during prolonged surgeries. To ensure patient safety and comfort, I carefully assess each patient's unique risks, considering factors like body weight, age, pre-existing conditions, and the expected duration of the surgery. Once the position is selected, I use appropriate padding and support devices to reduce pressure on bony prominences and prevent nerve compression. For instance, in the supine position, I place pads under the heels, head, and elbows to prevent skin breakdown and pressure ulcers, while in the lateral position, I use extra padding under the shoulders and knees to protect against nerve injury. I also pay close attention to securing the limbs properly in positions like lithotomy or prone, where joint strain or nerve compression could occur. During the procedure, I collaborate with the anesthesiologist to monitor the patient's vital signs and ensure that the positioning does not impede circulation or respiratory function. For prolonged surgeries, I stay vigilant about signs of discomfort or compromised circulation, such as changes in blood pressure or limb discoloration, which may indicate a need for repositioning or additional support. I document each aspect of the positioning process meticulously, including the initial setup, all adjustments made, and the support devices used, to maintain a clear record of patient care. After the surgery, I assess the patient for any signs of positioning-related complications, such as skin redness, numbness, or discomfort, which may indicate pressure injury or nerve involvement. This post-operative evaluation helps in the early detection and treatment of potential complications. Through careful planning, continuous monitoring, and proactive adjustments, I prioritize patient safety and comfort in every aspect of positioning, contributing to a successful surgical experience and reducing the risk of positioning-related injuries.